Hi, my name is Richard Width, and I am one of the hospice nurses with Atlantic Visiting Nurse. Today, I just want to talk to you about one of the medications in your comfort kit. That white box you received when you came on service. You know, the one we tell you to keep in the refrigerator because it's in a central location. Now, just as a refresher, these medications are used as needed, and we follow a fairly simple 3-step algorithm when we use them. Number 1, what's the symptom? Number 2, what's in my toolkit to treat it? Number 3, did it work? Rinse and repeat. Knowing that if there's no symptom, there's nothing for you to do but be authentically present with your loved one. So the medication I want to talk to you about today is morphine. Now, it's no different than any of the other tools in your comfort kit. I know it can be a little scary when you first have to administer it, but like all the medications in your comfort kit, it was developed for use at specific times and in specific ways. And if you use it appropriately, it can become one of the most potent and powerful tools in your arsenal to treat your loved one's shortness of breath or pain. Think of it this way. If you hold a knife by the blade, you will cut your hand. But if you hold a knife by the handle, it becomes a tool. It's the same thing with morphine. I know we have a lot of cultural bias against it, and rightfully so, because of misuse of drugs in our society. But that's not the case with the morphine that you're receiving in your comfort kit here. To give you a perspective about the starting dose that we generally use in hospice, the 5 milligram dose, that is as much morphine as is in a Percocet. It's really not that much, okay? Overall, the most important thing that I want you to remember is that when you administer the medications as prescribed from your comfort kit to deal with your loved one's symptoms, you will not be hastening death, okay? Our goal is to meet the symptoms where they're at. And to be honest, not giving a comfort medication when your loved one is having a symptom can potentially hasten death far more effectively than giving the prescribed dose of the morphine. Let me use another analogy to explain. So your loved one is in a plane and they've finally reached their destination and they are circling the airport looking for an open runway so that they can bring their plane in for a nice, smooth landing. They have to do that on their own. We can't help them land their plane, right? Symptoms are like sudden wind, turbulence, sleet, a hurricane. So the shortness of breath, the pain, the anxiety, all of those physical symptoms your loved ones has, they're like turbulence, making their job to land their plane very difficult because suddenly they're trying to land their plane through a storm. We can help them with those symptoms. So as I was saying, we're going to use morphine like the tool that it is to help decrease the turbulence so that your loved one can bring their plane in for a nice smooth landing, okay? Now, the way that morphine works, it controls 2 symptoms, pain and shortness of breath. Let me explain to you how it does this. Morphine works by controlling pain by erecting kind of a brick wall between your brain and whatever's hurting, right? It's not that the pain goes anywhere. I mean, if I've chopped off your hand, it's still chopped off, right? But your brain is blocked from perceiving it. That's also why it wears off, and sometimes you have to give another dose. The other thing that morphine does is it helps us deal with shortness of breath. It communicates with the part of the brain that's responsible for judging the carbon dioxide level in your bloodstream. Now, this is a part of your brain you cannot control. It's automatic. What the morphine does is it talks to that part of your brain and it says, hey, everything's fine, your bloodstream's fine, take a lunch break. And by doing that, it decreases those signals that the brain is sending to your lungs to breathe harder, breathe faster. So this is how the morphine works to deal with both the pain and the shortness of breath. Now, I'm going to be discussing the base dose we use in hospice, 5 milligrams, which, given the concentration of our liquid, when we pull it up, is going to be 0.25 milliliters, right? However, if your doctor has prescribed a larger dose, be sure to give that dose. Our goal, again, is to meet the symptoms where they're at, right? That's the only way we can effectively control the symptom. We've got to meet it with where it's at. We don't want to give too little, and we don't want to give too much. We want to give just enough. That is also why all the medications in your comfort kit are prescribed to be used as needed, so that you have some agency and some control to help mitigate the symptoms, okay? Think of it this way. You can't treat a winter storm the same way you treat a spring rain, right? Okay. So let's take a look at our morphine now. So here we are back again with our comfort kit, and we're going to talk about how to set up and administer our morphine. As you can see, this is just a sample, but it's our doofer for the day. So just go with me here, all right? First things first, whenever you're going to give a medication from the comfort kit, it's very important to wash your hands. I'm just going to use some hand sanitizer, and then I am going to put on some gloves. It is not important for you to put on gloves if you don't want to. However, I generally recommend putting on a pair of gloves before administering one of the liquid medications we have, whether it is the morphine, the lorazepam, the haloperidol, only because if you get that liquid on your hands, it's very sticky. And then you'll be washing your hands again. All right? So, when you receive your morphine in your comfort kit, it comes in a box similar to this. All right? In this box, you will have the bottle of medication, and you will also have this tool. So as you can see, this is an oral syringe, and it is inserted into this little plastic extender. This extender will be put into the neck of the bottle in order for easier administration. I'm going to open this up and show you how to use this. So when I say extender, I mean it literally. This extender actually comes off. These are two separate pieces. This you'll put into the neck of the bottle. Now, if this was our actual morphine bottle, I would open up the top. There would be a sealed paper on top of the morphine bottle. You'd need to take a pair of scissors or a knife and just get it off and open it up. Once you have cleared the paper off of the top, you take your little extender, you place it on the top, and push it down into the neck of the bottle. And it will sit and rest even with the top. So this is a different bottle than the bottle you'll be receiving, but for the purposes here, I wanted to show you how you take this tool out, how you insert this into the neck of the bottle. And the reason why you do this is because then you can take your oral syringe, place it into, and then simply invert the whole bottle and pull up your medication. For the purposes of our demonstration, I'm going to use the bottle that we have here with its own top. This is a slightly different top than you'll be receiving in your comfort kit, but the idea is the same as this extender. Here, I'm just going to pop. I'm going to take my oral syringe, place it in, and then as you can see, I can invert the bottle and pull up my medication. All right? Now, I'm going to leave the syringe in the bottle for a minute, but what I'd like to do is just take a moment to talk to you about your oral syringe. As you can see, there's no needle. And this oral syringe is labeled specifically for your morphine. As you can see here, we have 0.25 milliliters, 0.5 milliliters, and so on up the oral syringe. Your hospice kit generally starts at a dose of 0.25 milliliters. And if you twist this syringe, you can see on the back, that is equal to 5 milligrams. That's why this is your morphine syringe. It's specifically labeled to embrace the milliliter and the milligram dosages that you would be using while on hospice care. So now I'm just going to put this to the side and I'm going to pick up my bottle again and show you. So again, you've inserted your extender into the neck of the bottle. You are taking your oral syringe, placing it in the tip, and then you are using that to just invert the bottle. And let's say that we're starting at our regular dose of 0.25 milliliters, which is 5 milligrams. We're just going to pull down on the syringe here. You can see there's a little air bubble in there. Very easy to get out. You just push up, and then there we go. All right. You can see it might take a time or two. There we go. So I've pulled up to 0.25 milliliters. As you can see, the plunger that's at the tip of the oral syringe here is separate. You're not measuring to the tip of the plunger here. You're measuring to the base of the plunger. All right? So you can see we've got our base of the plunger is at 0.25 milliliters, which is 5 milligrams. Now, be very careful. You want to turn the bottle back around before you pull out your dosing syringe. If you do not do that, medication will go everywhere. There is nothing stopping gravity from pulling the medication out once you remove your oral syringe. Okay? I'm just going to cover that up again. So now that you have your oral dosing syringe, this medication gets placed in the mouth, in front of the lower teeth, between the lower teeth and the cheek. If you push this, if you push the syringe, if you look at my mouth here, we're going to extend it down so we end up giving the medication right in this sort of little chipmunk cheek area here, which is between the lower teeth and the cheek. Remember, this medication will absorb through the lining of the mouth. It does not need to go under the tongue, nor does your loved one need to swallow it. All right? So again, we just slide the oral syringe down between the lower teeth and the cheek, and then we would push our plunger to release the medication into the mouth. And then sometimes we give a little massage there just to help the absorption of the medication into the lining of the cheek. All right? I'm going to put this back in our little bottle. There we go. That is how you give your morphine. So I hope this little video helped, and it helped provide some answers and some information. If you have continued questions, please feel free to ask your nurse when they come to visit, or call the number on the front of your admissions packet. Again, that's 973-379-8440. That's what we're here for.